Hi, everyone. I'm Dr. Lidia Zylowska. I am a psychiatrist at the University of Minnesota. I also have been studying mindfulness for many years and bringing it into the clinical setting for patients and for clinicians. And I practice mindfulness myself and find it to be a tremendous help in the moments of stress and difficulty. Yet at this time, we're all so busy. This is a time of a lot of competing demands, stress, multitasking. And so, mindfulness is often recommended, and yet something that may be difficult to connect with. Often when I talk about mindfulness, there is a question, which is a fair question. How can I make mindfulness something other than another task on my busy to-do list, something that keeps stressing me out, that I know I'm supposed to be doing, but I'm not doing? And, at times of stress, it may be difficult to even be reminded to do a practice. I see articles on mindfulness now, and there's so many other competing demands. It's hard to even to look at that. Those reminders for self-care fall into the back burner. And yet mindfulness can be very helpful at this time. So I want to kind of break it down and help you bring mindfulness to your day without necessarily carving out extra time for it. So thinking of mindfulness as mindful awareness. I like the term mindful awareness because it emphasizes the shift in awareness that we can bring into anything that we're doing. And that shift can be very brief, just for a few seconds, but it can break the cycle of being stuck in and thinking, planning, doing, and rushing, allowing the buildup of stress to happen. So a mindful awareness shift can be a practice of bringing down the stress level in our bodies, in our minds. So mindful awareness has basically two components or two steps. One step has to do with attention or shifting attention to the present moment. And the second step has to do with shifting attitude. They go together, but I find that some people find it easier to start with the attention shift and practice that. And some people find it easier to start with the attitude piece. So let me tell you what I mean by that. So starting with attention is to, when things are stressful or when you go about your day, however it is feeling, is to have these brief moments of noticing your attention or paying attention to attention and deciding to bring it to something in the present moment. Oftentimes bringing it to your breath, your body, and inviting the breath and the body to relax a little bit. So taking a few deeper breaths as you go about your day, sitting at the computer or about to enter a patient's room, and noticing this softening that can happen when the attention is shifted from this busy doing mode. Another good place to bring attention to our five senses. So resting attention in, let's say, the experience of hearing sounds or noticing the taste and the texture of your food. When washing hands, noticing for the first 5 to 10 seconds the feeling of water, the feeling of soap, doing it a bit more slowly and keeping attention awareness on the sensations of the washing, the water, the soap, and therefore giving yourself a break from, again, this busy doing mode of thinking and doing. The second step, the attitude piece, is something that may be easier for people than shifting attention. Shifting attention may take some reminders, some practice, but we can start bringing mindfulness, having the intention to have an attitude of patience and kindness with ourselves in the midst of our day. Same thing with an attitude of patience and kindness with others. Bringing this non-judgmental, compassionate perspective to ourselves when things are difficult, acknowledging that this is hard, this is difficult. I might have a variety of feelings. I may feel numb, I may feel frustrated, I may feel sad, I may feel hard on myself or just overwhelmed. Having just the ability to acknowledge what is with compassion can really allow the feelings to be there without actually building up, without the stress building up. And I know as clinicians, we often have to just keep going, and it's very hard to quiet down and connect with what's going on inside. There might not be really opportunity, or it's not called for to spend too much time dwelling on feelings or your fear or anxiety. But brief moments of acknowledgement with compassion can really help allow the feelings to be there and be processed and not accumulate and create this buildup of stress and then burnout. So those two things, shift in attention and shift in attitude, can be your way of bringing mindful awareness to your busy day without feeling like you need to carve out time for another task. So I encourage you to play with that. Play with these two. And one practice that I think is very easy and quick and kind of brings those two together is to bring hand over your heart. And that helps bring your attention to your heart, to your body, perhaps feeling your breath. And it's a gesture of compassion. So doing that periodically throughout the day, perhaps when you're about to enter a patient's room, before a meeting, having that moment of connection with yourself. And I'll leave you with that, wishing you health and connection to yourself and others.